Hi, this is Dr. Daria Hamrah. I'm a facial cosmetic surgeon in the greater DC area. And today we're going to talk about facial aging. Now, facial aging is a process that starts the day we're born. As we get older, our body, our DNA changes, the gene expression changes. So all of these changes, they're programmed in our gene. Other factors of aging that contribute significantly to the aging process, not just of our face, but our body, is the way we live. So our health is important. The environment, the sunlight, for example, what we eat, whether we smoke or drink, all of those factors, they change the genetic expression. So there are several things that contribute to it. Our genes, which is our DNA, you can thank your parents for that. What we eat, how much we sleep, and how much stress we have. So, but without getting too much into the detail of the biologic aspect of the aging process, the purpose of this video is simply talk about how the face ages. So let's assume we all live healthy and we all live in a healthy environment, we have a healthy diet, and we get good sleep. How does the face age? Well, it kind of starts in the 30s. Once we're in the 30s, a lot of patients, they come to me and they say, Doc, my skin is not as smooth as it used to be. Or I see these wrinkles around my eyes. So the first and most common complaint patients come in with initially is the upper face. You get wrinkles on the forehead and maybe some wrinkles in the crow's feet and maybe some puffiness or a little bit of fullness on the upper eyelids, maybe a little bit brow descent, especially if you had low set brows to begin with, and eye bags. One of the major complaints, Of course, that has to do with your diet and sleep also. In the mornings, it's usually the worst with the eye bags. So I always tell my patients, don't look at your eyes in the morning because you're gonna be puffy. So that happens in the 30s. Once we get into our late 30s, early 40s, we start seeing our cheek descent going a little down, which causes these folds. We call them nasolabial folds. So as these, what we call mid-face, if you divide the face in 3/3, we have the upper face, we have the mid-face, and we have the lower face, and then of course we have the neck. So all these components, they flow, they go hand in hand. But the mid-face, most patients see descent of the fat and the cheeks, that then if it goes down, it creates these folds. And that's one of the main complaints in the 30s. As we go further along in the decade, we hit the early 40s, this turns into this. So when this descends down, it turns into what we call jowling, the fullness in the lower face. So all of a sudden, once we're in our 40s, we notice that our face turns from an oval or triangular shape to more of a square shape because of the fullness down here and the emptiness here. So those are the main complaints in the 30s and 40s. As we go further along into the early 50s, it starts getting into our neck muscle starts loosening, we see these bands coming up, and the jowl gets further, descends further down into the neck, and everything moves from up in the cheekbone area towards the corner of our mouth and our jowl. So it goes kind of like this. So there's no person in their 40s that hasn't stood in front of the mirror and kind of done this. And that's why we do this, because our face kind of droops this way. So it's very important to know these things because understanding the facial aging is key to success when we start rejuvenating the face. Unfortunately, a lot of doctors and practitioners get the part of aging wrong, and when you don't understand the facial aging, you can't come up with a proper treatment to counter that. Meaning, if you start in the lower face when you start rejuvenating a face and you don't address the upper face, people will look weird. I always get these comments of patients that are really fearful of any procedure just because they have seen people that kind of look weird and they don't know what to attribute it to, but they just know that they had a procedure done. So therefore, they label every type of rejuvenative procedure or plastic surgery as they demonize it just because they might have seen a result that they didn't like, and usually it's because it looks unnatural, and that is based on the misdiagnosis of the doctor that addressed that face or performed the procedure. So whenever I address the face, it doesn't matter what my patient comes in for. I always go through this process explaining how the face ages, just to give my patients a context as to what they're seeing. And it's very important as someone looking for rejuvenation procedure that you understand these things, because ultimately what you care about is looking better. You know, I don't expect my patients to know exactly what's happening to them. Unfortunately, we have a lot of us, including myself, we refer to Google or the internet to try to self-diagnose ourselves and to come up with a treatment, and then we start shopping around for a doctor that does a particular procedure. So I usually ask my patients to take a step back, walk them through the facial aging process, so then they have context to understand what I'm proposing, the different options. So again, just to summarize, the facial aging starts from top and it goes down. And that's how gravity goes, unless you live upside down like a bat. But again, the first thing is with the brows, eyelids, upper eyelids, they descend, create the hooding, kind of makes you look like sad and tired. That's augmented by the puffiness and the wrinkles on the lower eyelid and your crow's feet, and then further along with your cheeks, and then further along then with your lower face and your jowls, and then your neck. Patients always ask me, what's the best time to address these issues? Well, it depends on how much it's bothering you. I always tell my patients, if you think about something more than 3 times a week, it's probably time to do something about it. Otherwise, let go. And when you search for someone that addresses your problem, do your research, make sure you find someone that has expertise in that particular procedure or the face, and not just go to someone that is a jack of all trades. Unfortunately, we're all humans. We can't be good at everything. And luckily, though, with the internet, social media, research has become much easier. Always look at before and after pictures, and make sure your doctor addresses all your questions and concerns properly. And don't do anything unless you fully understand what you're getting yourself into. Thank you very much for watching this video. You can click any of the links below to get in touch with me if you have any questions. I always answer these questions personally. You can follow me on Instagram, Facebook, TikTok, or just follow my YouTube channel and subscribe to it for more information. Thank you very much, and have a great day.